We're in a health crisis. There's no doubt about that. People are dying. They can't get emergency surgery. They can't get an ambulance. This is something I have not seen in my 30 years' experience as a nurse in the health system. How could we be here now, after 2 years of government telling us they were preparing the health system? I'm horrified to hear that after being told to stay home so we can have the health system prepared over and over by the Premier, that there are less people taking 000 calls for the ambulance today than there was 2 years ago. How is that preparing the health system? I can't accept that the Andrews Labor government promised 4,000 ICU beds and now they're not delivered. They've even tried to deny that they made that promise. But the worst part is, this isn't pandemic-caused, and that's in the words of Dr Sarah Whitelaw, a senior emergency physician at the Royal Melbourne Hospital, who said the system was under enormous pressure before COVID. This was predicted 10 to 15 years ago, that the system would be at capacity. COVID has just pushed the system over the edge. The government's own Productivity Commission report tells us that the state of Victoria has less investment per capita than any other state in our nation. Victoria is poorly funded in health by this Andrews Labor government, worse than any other state in this nation. That's the Productivity Commission's report. That's not me saying that. That's a government's own Productivity Commission's report. This government have been in power for 18 of the last 23 years, 2 decades, almost 2 decades, and what have they done to the health system? Yet we've been hearing for years before the COVID that 500,000 people were coming into the state each year. They needed to plan. They needed to plan to have the adequate health services, and they were warned. The ambulance system is in crisis. Every day in my office, people are telling me terrible stories about not being able to get ambulances, not being able to get services. And it is not the people in accident and emergency doing their damnedest who are having to make really tough decisions about priorities, because they have to prioritise the sickest person. And then we're seeing things like the child in my electorate who had a burst appendix and couldn't even get into the Royal Children's Hospital, but had 26 people in front of her trying to get a bed, a 5-year-old with the likelihood of peritonitis and death imminent. It's horrible stories like that. On Friday last week, a senior emergency physician, Dr Stephen Parnas, told 3AW that the Victorian emergency departments are a dangerous place to be in. Labelling the current conditions as utterly unacceptable. He said that without doubt we're losing lives that we could have saved and should have saved. Can you imagine working in ED at the moment as a nurse? Can you imagine the pressure? They are extraordinary, and no one is saying it's the fault of the staff, the nurses, the doctors, the speech therapists, the orderlies, all the people who are doing their damnedest, double shifts, going in on call, putting their families second. That's not what we're saying here. We're saying the government knew this and did not prepare and did not plan. Even with the pandemic, they didn't add extra services. They called, all this spin that's gone on, they called for people to come and volunteer. 16,000 people with expertise in health put their names down to come in, but they didn't call them. They weren't those people doing the swabs when the nurses were exhausted. They weren't there. They're not now on the triage for the ESTA calls. There are so many things this government could do, or all they do is talk and not really act. The scratching of the surface is so easy to unveil the mistruths. The appalling state we find ourselves in, a code orange, again, just yesterday. 10 hospitals promised at the last election not being delivered. Promised in 2018, and here 4 years later, nothing. In Warrnambool, the accident and emergency is overflowing, and that's not because of the staff not doing their damnedest. They were saying this before I was elected. In 2015, they were begging for a new hospital, which we committed to. The government finally came kicking and screaming in 2020. So far past the use-by date is the A&E that patients are being treated in the corridors. They are actually trying to rejig something as we speak. It was in the paper last week, so they can service the community in the A&E because it's been bursting at the seams for so long. Maybe they're worried about the hospital not being delivered on time, because in the annual report of the Warrnambool Base Hospital, it says that it would be delivered later than expected, so 2027, but the minister last week said that's not correct, it will be delivered in 2026. We need clarity on that, and why the discrepancy? I'm very concerned that they'll push us back. Those 3 theatres were the same theatres that I worked in the 80s. Now, if you have a complex hip on one and a shoulder on another, and you've got an emergency, let me tell you, in an emergency situation, you can't close up quick enough to put an emergency C-section on the table and get a baby delivered quickly. And we will see tragedies. I haven't wanted to say that in this place. I haven't wanted to say it because I don't want people worried. But now it's got to really concerning. It's concerning when we've got 10 hospitals that have been promised in 2018 not delivered, and a hospital in our region that needs to be delivered as a priority. As a priority. We've already got babies being delivered on the side of the road. We've got a government not doing their job in planning. We warned this government in a recommendation of the perinatal inquiry. 2018, the recommendation came down to do some workforce planning. Today, in question time, the minister quotes that back. We need to do some workforce planning. No kidding. That's what the report said in 2018. And yet, guess what? Not one action. Nothing. None of those recommendations acted on. And yet we said we would be needing midwives in the region, and that's why Portland is closed, because they can't get midwives. And they hadn't even bothered advertising until I pushed that in the press and shamed them into starting to advertise. The minister just ignores the regions. Only this morning I got this text from someone inside the hospital at Portland. We have no anaesthetists at all this week. All surgery cancelled this week. No resuscitation or airway management. So little hope for potential cardiac or respiratory arrest. Next week, our only anaesthetist should be back from sick leave, but all major surgery is cancelled indefinitely. Example, orthopaedic surgeons can do minor items like carpal tunnels. They're under locals these days. That's me saying that. But no hips or knees. This has come about because we lack a surgical registrar to care for inpatients. There is no news on the third anaesthetic, anaesthetist or second general surgeon, whilst we wait for the Department of Health to offer applications reasonable contracts. Now I'll add my bit in here because they keep telling me this. The contracts they are offering are so unattractive, no one's taking them up. I'll go back to the quote, and it's a quote from someone who I will not say who it is because they can't speak out. Lastly, they say, it is all such a travesty, especially when Warrnambool cannot cope with their own workload. Now, when I put that to the minister in question time today, what's his answer? In regards to the assertion that the services are not available in our region's communities, that is simply not correct. Well, you tell me how come we've had the ophthalmology service cut, we've got anaesthetic training cut, we've got maternity services shut. If that's not services being cut before our very eyes, I don't know what is. But again, I am not talking about the good, hard-working people within the health system doing their damnedest in Portland, Hayward, Port Fairy, Warrnambool, really hard-working, and I'm genuinely concerned about their burnout levels. This is just such a difficult situation. I had a phone call this morning from Bernie Wilder. He's a man who they believed was having a stroke. Because he couldn't see a doctor in Portland, the ambulance took him to Hamilton. His stroke turned out to be Bell's palsy, very reasonable. It's a dropping of the face, so it looks like a stroke. Once it was determined it was not stroke, he was asked to go. And the staff were under so much pressure, and I can picture this. They would have been off to a cardiac arrest or off to someone hemorrhaging. And this guy had travelled over 100 kilometres in an ambulance. It doesn't normally go off to Hamilton because it could have been dealt with in Portland. And here he is on the street. $250 to get a taxi back. No system in place for that poor guy to get home, sitting there unwell and trying to work out how to get back to Portland. There's no public transport. The system is collapsed. We've got nothing in place because this government has not done the planning. How did we get in this position? It's so easy to blame COVID, but you can tell by what I've said that that's not the reason. It's been at breaking point for years, and this government has not invested. They've told us about 10 hospitals. They didn't deliver them. They've had 2 decades. They've not prepared. They promised 10 hospitals, and they better deliver on the South West Health care service. There are less people taking 000 calls today than there was 2 years ago. That is not a government who prepared. That is clear evidence they were ignoring the situation and spinning out all this stuff trying to tell us they were doing well. This is one hell of a fail.